Hello friends, today we are going to see about fifth cranial nerve, that is trigeminal nerve. In this video, we are going to see about its introduction, nucleus components, branches and clinical anatomy. First of all, we see about its introduction, which is the largest cranial nerve which have three branches, that is ophthalmic, maxillary and mandibular, and it is the nerve of first branchial arch. It supplies the four parasympathetic ganglion. They are ciliary ganglion, pterygopalatine ganglion, otic ganglion and submandibular ganglion. Next we see about the nucleus. It consists of two nucleus, general somatic afferent and branchial efferent column. In general somatic afferent, there are three main nucleus, that is spinal nucleus of fifth nerve, superior sensory nucleus of fifth nerve, mesencephalic nucleus. Now we are going to see these three nucleus in detail. First of all, we are going to see about the spinal nucleus of fifth nerve, which carry impulses of pain and temperature. The crossed fiber are called as trigeminal lemniscus, which go to the ventropostromedial nucleus of thalamus for relay and terminate in the lower part of postcentral gyrus. Next of all, we see about the superior sensory nucleus, which carry touch and pressure, which relay in this nucleus, and the remaining part is the same of the spinal nucleus. Next we see about the mesencephalic nucleus. The mesencephalic nucleus extends from pons till midbrain and it receives proprioceptive impulses from muscles of mastication, TMJ and teeth. Next we are going to see about branchial efferent column, which is located at the level of upper pons. The fibers of motor nucleus supply 8 muscles which are derived from the first brachial arch. Next we see about the sensory components. The main sensations are pain, temperature, touch and pressure from the region like skin of face, mucous membrane of nose and most of the tongue, nasal air sinuses which travel along the axons. Next of all, we see about the fifth ganglion, that is semilunar ganglion or the Gesserian ganglion, whose cell bodies are lying in this ganglion. This ganglion, which is equivalent to the spinal ganglion of other nerves. It is located at the petrous part of temporal bone and that place is called as Meckel's cave. We already see that the pain and temperature impulses are carried to the spinal nucleus and the touch and pressure sensations are carried by the superior sensory nucleus. Next, we are going to see about the motor component. The motor nucleus receives impulses from right and left cerebral hemispheres, red nucleus and mesencephalic nucleus. The fibers of motor root supply 4 muscles of mastication and 4 other muscles, that is tensor veli palatini, tensor tympani, mylohyoid and anterior belly of digastric. Next, we are going to see about its branches in brief. That is the ophthalmic nerve, maxillary nerve and mandibular nerve. The ophthalmic nerve is purely sensory and it branches is frontal, nasociliary and lacrimal. The frontal consists of 2 branches, that is supratrochlear, which supplies upper eyelid, conjunctiva, lower part of forehead, and supraorbital supplies frontal air sinus, upper eyelid, forehead, scalp till vertex. Next of all, we see about the nasociliary, which consists of 5 branches, that is anterior ethmoidal, posterior ethmoidal, long ciliary, nerve to ciliary ganglion and infratrochlear. Next, the last branch is lacrimal. Next, we are going to see about the maxillary nerve. In the middle cranial fossa, it gives meningeal branch, and in the pterygopalatine fossa, it gives 3 main branches, that is ganglionic branch, zygomatic. On this zygomatic, it is further divided into zygomatico-temporal and zygomatico-facial. Then third one is posterior superior alveolar, and in infraorbital canal, it is divided into middle superior alveolar, anterior superior alveolar, and its terminal branch lies on the face, that is palpebral, labial and nasal. Next, we are going to see about the mandibular nerve. In the trunk, it gives meningeal branch and nerve to medial pterygoid, which supplies tensor veli palatini, tensor tympani and medial pterygoid. And in the anterior division, it gives of deep temporal, lateral pterygoid, masseteric, buccal. And in the posterior division, it gives of auriculotemporal, lingual and inferior alveolar. Next of all, we see about the clinical anatomy. If any injury occurs to the ophthalmic nerve, there is a loss of corneal blink reflex, and any injury to the maxillary nerve, there is a loss of sneeze reflex. And in injury to mandibular nerve, there is a loss of jaw jerk reflex. Next of all, we are common in trigeminal neuralgia. That is the principal disease which affect the sensory root of fifth cranial nerve and characterized by attacks of severe pain in the area of distribution. Thank you.